Can you speak something? Ma'am?
I hope you can hear me. Good morning, good afternoon, for all of you.
Can you just check live? You're live. Are you able to hear?
Good afternoon, everybody.
1 second, doctor. Yes, we are on. We are on. Voice. Thank you for being with us, ma'am. Let's get into the webinar, please. Very good afternoon. This is GRI Center. We are here on 8th webinar series of Gandhigram Rural Institute deemed to be university on the first day on this 5-day webinar series. I thank Dr. K.M. Annamalai, our Chancellor, for supporting us, Dr. M.R. Kubendraan, Vice Chancellor in charge, who is supporting us in this webinar, and Dr. V.P.R. Kumar, our Registrar, for giving us wholehearted support in bringing this webinar as a successful webinar. Today we are international, thanks to the alumni of Gandhigram Rural Institute deemed to be university, those who have joined us abroad, and everyone. Today we are easy job as such because there were sleepless nights, tireless efforts, endless data which is coming in. With a great difficulty, we as a country with 130 crore of people have managed the pandemic. We have tried our level best to curb the pandemic. Just it's easy to say, but we have someone as a special guest for us today to give us a overview on how the government of India tackled this pandemic or tried to curb the pandemic. We have today with us Dr. Preeti Sudan, IAS, former Secretary of Ministry of Health and Family Welfare. We tried our level best to get Madam in between, but due to a very busy schedule, we were not able to get it when she was on office. Today, in spite of being in a retired life just 2 months before, but Madam is as busy as she was earlier. We welcome Dr. Preeti Sudan ma'am for this webinar. And to introduce, I have very few words to introduce. Like, in fact, if I have to quote the media, Dr. Ma'am was mentioned in many of news and media as a strongest woman in the country. Dr. Preeti Sudan is an IAS officer. She is 1960 born, and she has come getting her IAS in 1983. And ma'am has done her BA honors in English, MA in economics, MPhil in economics, PG in social planning, and PhD in economics. She had held a lot of positions in the ministry. She was at a designation level. She was in Department of Office in Health and Family Welfare. She was secretary at the time of retirement. Ma'am was secretary also for Consumer Affairs Ministry, Food and Distribution, Public Distribution. She was special secretary in Ministry of Women and Child Development, additional secretary in Women and Child Development. Madam was joint secretary in Defense. She was principal secretary to Revenue Department, commissioner of Disaster Management Department, and so on and so forth. Due to the paucity of time, I am not able to give a proper introduction to ma'am. Thank you so much, ma'am. We welcome you in Gandhigram University webinar. Today's topic is COVID-19, India's efforts in curbing the pandemic. Thank you, ma'am. Can you say something, ma'am?
Yeah, can you hear me now? Can you hear me now? Am I audible?
Yes, yes, please.
Can you hear me now?
Yeah, sorry for the inconvenience.
So do you want me to start from the beginning, or can I just go on?
You can just go. From the date of pandemic, you can just go.
Okay, so I was just saying that, our approach has been proactive, preemptive, and graded. And that's basically because This is an evolving pandemic. We didn't know much about it. We banked on our experience of handling disasters and also, Zika and Nipah diseases. Now, when we got to know of this disease in the on the 29th of December, that is officially from WHO, but we were hearing informally in the news and social media of a pneumonia in China, in Wuhan, which was rather unexplained. You know all that. You must have read
Yes.
in the newspapers. Now, it was, I have to say that if we look at the figures today of India, we have a diverse population, diverse geographies. We have 1.38 billion people in our country, but we have constrained the number of cases to 7,975 per million, deaths at 113 per million, case fatality rate at 1.42%. This is much, much lower when compared to the developed countries also. We have a recovery rate of 97.22% with active cases less than 1.36%. So we have done pretty well. And as I said in the beginning, this is only due to the collective and united effort of India as a whole. And I think but we have to learn lessons from this also. So as I was saying that, late December, we got to know of this disease. Now there is a standing, joint monitoring group in Ministry of Health, which is headed by the Director General or DG Health Services, Director General of Health Services. This group was convened by the EMR. EMR is Emergency Response Unit, and he convened, Director EMR convened this meeting saying that there is this information of a unknown pneumonia, so let's sit down and deliberate on it. This happened as early as 8th January. So 8th January this JMG met on its own, and they reported to say the secretary. I mean, I was heading that, I was secretary at that time, and we started our own brainstorming. We of course informed our higher ups, and immediately everybody came together. I want to also say that this fight has been led at the highest political level by the honorable prime minister himself, then at the highest bureaucratic level by the cabinet secretary, and the PMO, the all the ministries, the kind of support health ministry got, it was a united effort. And it is very, very heartening that on the 17th January itself, we issued our first advisory. And this advisory basically was of telling people that please avoid unnecessary travel to China, please be alert. And on 18th January itself, we started thermal screening of people arriving from China, Hong Kong, and all. And let me also tell you in this context that it was only on 13th January that the first case outside China was found in Thailand. And at that time, WHO said that there is very limited evidence of human to human transmission. So much, much before, you see, that's why I said our um, response has been proactive because, and preemptive, because we started our screening on the 18th itself. We issued our advisory on the 17th itself. After that, you all are witness to the numerous meetings that the health ministry held with the principal secretaries of health, the numerous meetings that our NCDC, the National Center for Disease Control, held with their units. And it has been, it is a journey which needs to be documented, which is being documented, and which is actually a lesson for the entire world. I am on this, international panel for pandemic response of WHO, and people are really not able to um, uh, absorb how India, such a big country, and for us, the world had said that it will be a doomsday if India cases come up in India, but we have tackled very well.
Yes.
Our first case came on 30th of January. It was a student from Wuhan who had returned, and subsequently it was in Kerala, and subsequently the first three cases also. The second and the third index case were also students who had returned from Wuhan. So, if I say that, what did India do? You see, we began with just one laboratory. It was NIV Pune, and it's this test requires what is called a BSL-2 lab. Now we have a BSL-4 lab in Pune. And let me again also tell you that why it's important. For H1N1, we used to send samples abroad for testing. So here we had this testing facility. We were able to, decode the virus and identify the positive cases. And initially, we used to do two tests. The first one initial, and then second one to confirm whether the person was positive. And all the samples used to go to Pune. And today we have more than 2,300 labs spread over the entire country. And the vision is that henceforth, all the district hospitals also having beds of 200 plus will have their own BSL-2 labs. So first and most important was the testing. Second was surveillance. You see, we had people coming from abroad. We had they had to be we were lots of and then another thing I want to say is that I told you that our approach has been our DGHS and had experts who were epidemiologists, who were from AIMS, who were doctors, and we followed their advice. And parallelly, there also started a technical group under Dr. Paul and DG ICMR, Secretary Health. They were all members and they were experts again from all over, who were deliberating on COVID treatment, on steps to be taken, on possible lockdown and all those issues. So, if Indian government's response, it ranged from expanding access to personal protective equipment, because you see, when you are asking people to go for surveillance, when you're asking doctors to treat patients, they need protective equipment. That's very, very important. Then you need healthcare infrastructure. So, ramping up a healthcare infrastructure, devising effective risk communication. The whole India needs to know what to do, because even I didn't know what to do initially. Then capacity building of professionals, participation in vaccine development. So there were these issues which were, we had to take action on many, many fronts. And the government response was whole of government. As I said, it was led by the Honorable Prime Minister. And there were 11 secretaries, nine secretaries and one CEO, Niti Ayog, and Dr. Paul, member Niti Ayog, who headed empowered groups. These groups were in charge of again, looking technically at issues, ensuring that risk communication material is developed, looking at how logistics are to be managed, how the protective equipment, masks, and how we have to ensure that our health workers are protected. Then also, how because you see, there was also restrictions on flight movements and all, how we will ensure that essential commodities reach the states. And initially there was all central procurement, so the states were given, actually we purchased PPEs, we purchased masks, we purchased ventilators and gave to the states. Of course, now, as you know, they are all on our on GEM, which is the government e-marketplace, and you can buy. Now we are exporting. So it's been it was a whole of government approach, and these have also, you see, uh, guidelines were issued by the ministries. Guidelines on surveillance, guidelines on home quarantine. If you are in home quarantine, what do you do? Guidelines on, you see, what the Asha Anganwadi workers will do, ensure that rations reach people who are there, how the communities have to behave, how the clinical management guidelines they reach all the states, because we kept on learning from experience. Initially we thought these antivirals of loparin and all will work, then we thought hcq will work, then we all these, so the drugs also, the drug regimes also kept changing with our experience. So that's important, that all of us followed the same protocols. Then there was also, 24 by 7 helpline for doctors, which was available in AIMS Delhi, so that the clinical management help could be given to the remotest of our areas. Then, when we started to expand infrastructure, the dilemma was, and I think I have always been saying informally also, I really feel that God actually guided us because we made our treatment centers dedicated centers. You see, we did not mix the COVID and non COVID patients, and thereby we contained the infection in our hospitals. I think that was a great thing done. And also, we did not convert our CHCs or PHCs or sub centers into the COVID centers. Only district hospitals and above, and entry and exit were also different. And the first COVID center that we created was actually Safdarjung's new block, which we converted it into a COVID care, a COVID hospital. So there were three types of infrastructure we created: COVID care, and then ICUs. So you see, today, of course, we have 15 lakh, COVID care. Just a minute, we have about 15 lakh total isolation beds with 2.6 oxygen supported and 78,000 ICU beds, about for 40,000 ventilators. Let me tell you that we had always imported ventilators, we didn't have our own. But I must congratulate and acknowledge the role of private sector here also. We did not have PPEs. The cloth for PPE, and we started making our own cloth. And today we are exporting PPEs. So a country that used to import cloth is exporting PPEs. We are also exporting masks. We had just two, manufacturers who again used to get the filter from abroad. Today we are making it on our own. And similarly, as I said, for ventilators too, it's been a extremely gratifying, I would say, whole of country, whole of society response. And you are aware that, and and we use technology. So you see, we suddenly ramped up our eSanjeevani was a software, a CDAC software which we had, which we were actually using for peer learning in our medical colleges and AIMS. Now we quickly converted it into a telemedicine tool, and more than 23 lakh sessions, consultations have taken place, and it's been great. And Tamil Nadu, incidentally, the South has done very well in that. I must congratulate them also. And apart from that, we created a portal for training. So this I got, you know about it. I got is a platform where we have trained lakhs of, our our public health workers, our community health workers, even the civil defense people who volunteered, then the retired um, uh, health officials who came forward and volunteered to help. So it has been a tremendous effort. Then we also created a website called covidwarriors.com.
Yes.
So there you could volunteer. We had names, not only volunteer, we also took out, made a directory of, you see, our human resources cell did great work in that. It was headed by our one retired who is retired now, one secretary textiles. So he actually um, had a a directory of health workers state-wise, because states needed people. So where do they go? So what do they do? Whom do they contact? So therefore, technology was used in the most optimum manner for public good. Then, as far as vaccines are concerned, you are aware, tremendous manufacturing capability is really an international public good. And we have our own vaccines being manufactured. And as of yesterday, 2.44 lakh sessions of vaccinations have been completed. First dose beneficiaries are about 1.04 crores, second dose about 12.58 lakhs, total about 1.17 crore people have been vaccinated as per priorities fixed by the
Government.
empowered committee formed for the purpose. So therefore, this journey has been tremendous. I mean, I have so much to say, but I just want to also add that if you will recall that how I used to often wonder as health secretary that how am I going to inform the entire country about this pandemic, what to do, what is COVID appropriate behavior. And it was the Honorable Prime Minister's address, if you remember, our uh, voluntary lockdown that we did for that one day,
Yes.
and how the whole world, the whole country came
Responded.
together to the acknowledge the Janta curfew, we called it, acknowledge the health workers and observe COVID appropriate behavior. So I think I'll halt here. Again, I'll summarize that we were able to ramp up infrastructure, ramp up our also our logistics, the essential commodities, create in-house and within the country capabilities. We were able to also retrain our people. We were able to do surveillance. So the states filled up posts, vacant posts. They did so much of monitoring, and it was possible only because we were one country, despite being the states having different parties holding office. I think it has been an incredible journey, but we have to keep on. Even after vaccinations, we have to observe COVID appropriate behavior so that we continue to be safe, and yet we go back to our opening the economy and being, ensuring that livelihoods are not affected anymore. And also the safety nets, I'd like to say, that free ration also amount in normal people, they came forward, offering food, offering rations, offering shelter to people. So it has been a journey of collective goodness of our country, for which I think all of us feel very proud that we are Indians. Thank you.
Really, really, madam. Uh, it's very, very easy to say that yes, we have managed the pandemic. Uh, yeah, ma'am. Sorry, there was a disturbance. It was very easy to say across the world. People feel that yes, India can manage. How did they manage is what something a true leader like you can explain how we were able to manage was in a very simple words, ma'am. But one thing I remember, uh, I should thank even at the outset I should have done it. I should thank Kavita Narayanan madam, our board member, for roping in speaking to you and convincing you to come in this webinar. I have seen, madam, uh, like it's very simple words. Whatever she says, I just repeat: clueless beginning, sleepless nights, endless searches for appropriate medication, matchless efforts by the entire country, and countless data which are coming. What to do with this kind of pandemic? Absolutely, madam. We all, as a citizen, would like to salute you for your kind of coordination, whatsoever has been as a leader, as a team, both as a leader as well as
No,
as a
no,
team.
no. I don't need to be saluted. You don't know how much work Kavita has done. All that COVID warriors I'm saying is hers. There have been numerous, my entire team, and I tell you, secretaries from various departments, and of course, as I said, led politically by the Honorable PM himself, by our health minister, by earlier secretaries, and bureaucratically by the cabinet secretary. How many meetings he had with the chief secretaries, and most important by the people in the field, the states, tremendous work that states have done. Even at 12 1 in the even at midnight they used to call up and say ki hum ye ho gaya wo ho gaya, and how much work they've done. I mean, I have to salute them, and I'm just very grateful to God that I got this opportunity to serve my country.
It was
And
really today life we are facing. It's really, I should say, as you rightly said, God Almighty has helped us
yes,
in coming out of this kind of situation. Uh, I have a couple of questions, ma'am, just to conclude, because I'm aware that you have your very busy schedule even now. You're parting your time with us, precious time with us. Uh, People say, I was interacting with a couple of physicians, and this question is from my side. The way the state protocol is maintained, or a total protocol maintained, how did you conceive this concept, ma'am? Because everywhere in India, people say that sab chalega attitude. But in this COVID, I see, like in war, the entire country came together in one line. How did you make it possible, ma'am? The state protocols or protocol to say for treatment.
two things worked. First, I would say to you is that we initially in March itself, with if retrospective effect from 17th of January when we issued our first advisory, the Home Secretary delegated powers of disaster management to the Health Secretary. So we were working under a legal framework also. That's one. But the legal framework is fine. However, it is also the political will, the bureaucratic will, and the will of the people. They if they come together, then only it's possible. So we used to actually, as I said, I don't even have a count of the meetings that I had or my officers had, or even the cabinet secretary, how much time he gave us, he had with the chief secretaries. We would hear them out. We would, convince them. I mean, actually, they needed no convincing. We were all on the same boat. I mean, there was just exchange of ideas. Because you see, government of India was in a position to know more than the states, and the states were in a position to tell us more what's happening on the ground. So there were two things. One is the technical knowledge. The second is what is happening on the ground. And I think these two aspects gelled so well in decision making and implementation. That I think is our real success story. And people, I mean, ordinary people, how, if you will recall, how in Italy old people died, way of living, and are coming together. I think all that is a testimony of how we have handled COVID.
There's one layman question from me, ma'am. There is a myth, you can say, or something like true also. Uh, Due to the vaccination we have practiced right when a child is born, has helped increase of immunity or a greater immunity as compared to the other people, along with the food habits. How do you respond to that, ma'am?
Now, first of all, I'd like to say that our universal immunization has 12 vaccines. And we have a very good system of cold chain of, our trained woman power mostly, but manpower plus woman power,
Yes.
our ASHAs, our ANMs, and we are all able to do vaccination very well. And of course, second is that we have tackled many diseases. Our we Normally our food is very healthy. There are immunity boosters within our in our kitchen itself, and the kada, the haldi, and everything, they have food
Yes.
to be healers. So we do not the normal Indian does not have too much of junk food. And then we also I'd like to share with you that I sometimes I used to think it's such a blessing that our villages are free. It was, this virus is very fond of crowds. It chases people who live in closed environment. So our villages where the houses are in the open, we have more place, we have fresh air. Those were the areas that were not affected much, and that is also part of our living ethos. So and then you remember we used to have that angan, the
Okay.
open,
Yes.
so that every room has air circulation. I think those are the things that have helped India. Of course, that from time to time the immunity booster advices were also given both by Ayush and by Ministry of Health and Family Welfare. I think all this has also helped us.
Thank you, ma'am. One thing which came to my mind, we are doing vaccination, ma'am, rampantly. We are considering the frontline people. There is a spike in this pandemic, uh, limited to a couple of states like Maharashtra, like Kerala. Uh, is it possible to contain that by doing uh, focused vaccination in those states to contain it? Because Delhi-like places, it has come down. The numbers have come down. Well, what's your opinion on that, ma'am?
So let me tell you that first thing is, of course, today's figures show that again there is a decrease in the active cases. I was so relieved because since a week there has been a steady
Increase.
increase in the active cases, but today there is again a decrease. So I think we had become a little complacent. For example, there was a case where, in a city where there was a wedding in the apartment club, and there, I think it was Bangalore, there 103 guests got infected. So we can't go back to that yet. We can't go back to that. And another thing I'd also like to say that, vaccination, this is under emergency use authorization. We must understand that. Yes, our vaccines are safe, but there is actually there's a very good video made by WHO, which I will email to you and you can circulate, saying that the efficacy of all the vaccines has to be studied over the long run. So we have to see how long, how much. There was another question that was asked, that if I take a vaccine, I am the person who's vaccinated is safe, but he's not affected by the disease. But does that also mean that he doesn't infect others? We don't know. So you see, I'm just trying to say that there is still you must remember that it's an emergency authorization use. Please Google on and find out, see the latest WHO video on questions regarding vaccination. So that is why again and again, everybody, including Government of India, everybody is saying that COVID appropriate behavior has to be observed. It's not that with vaccination. In fact, the herd immunity that we say, we are a big population, so we have to ensure. that we are responsible for our own health. And incidentally, I'd like our health workers, our frontline workers are now receiving vaccines soon. The old age people, senior citizens, people with comorbidities will receive. But even after that, COVID appropriate behavior is the key to our safety.
That's a real good words, ma'am. No doubt about it. We have to maintain that even in future also. It's a bit technical question, ma'am. Most of the people, whether they understand or not, there are two type of vaccines which are available now. One in our country and one abroad. Uh, One is based on RNA and one is based on DNA, ma'am. This RNA can, like what we people are getting this, and in DNA particularly, those vaccines changes the DNA of people is are characteristic of people. This kind of fear is there. How do you feel?
So I think Dr. Guleria and the who's the director of AIMS,
Yeah,
and also Gagandeep, who's a vaccine expert, and also the DBT secretary, Dr. Uh, they have been explaining the difference. Now, mRNA is a new platform. Okay, and these are the two vaccines that are used in US, and these vaccines were never such vaccines were never used on humans earlier, but they are being used now, and they are said to be safe. We are using two vaccines, Covishield and Covax, and these both also are safe, very safe, especially the Bharat Biotech one is inactivated virus vaccine. All the 12 vaccines that we are using under the universal immunization program are based on this platform. So both these our Indian vaccines are on known platforms, and they change the DNA and all that. That's not correct. Safety is not an issue. How long they give us protection, all that has to be proved in the long run. That is why they are under emergency use authorization.
thank you so much, ma'am. I'm coming with my last question. It's running out of time for you. The last question is, ma'am, we have amassed a humongous number of data as far as this COVID is concerned. Right from day one till today, even India leading in this particular front. With the kind of data we have, what kind of contribution we can do for the mankind?
I think it's tremendous data that we have. We have surveillance data now, and that's with NCDC and Ministry of Health. Then we have now vaccination data, and that is we have a special CoWIN application for that. You may have seen. I think this data is very, very precious. It will help us in, it has actually helped us. I would like to share that it's not out of the blue that these vaccines have come. It was because these were shared with our institutes. This was shared with the private sector partnership by the institutes. That's how we got our vaccines. So this data and the samples that we have collected, and also the vaccination data now, this will come in very handy for us to prepare for future, God forbid, future epidemics or future outbreaks. Because I would like to say that there could be outbreaks. I hope there's never a pandemic or an epidemic, which is a smaller one. And let me tell you that we did contain Nipah and Zika outbreaks very effectively. I'm sure with this tremendous experience that we have gained with COVID, we will be able to do much better in future. And also that the government is moving now in the right direction, in the sense that we are talking not only of curative health, we are talking also of preventive and promotive health, which is that well-being. For the first time, actually, I think the world has not heard of it, only we started that
Yes,
preventive and promotive health is the key to good health. We can have all the facilities for treatment, but if we are well, if we are have immunity, if we have the right eating habits, the right lifestyle, then we will be protected automatically. So I think that's where India is moving now. Of course, a huge impetus has been given to health sector in this budget, as you've seen the Atmanirbhar initiative, where we are going to have infectious disease blocks, where we are increasing our surveillance units, we are increasing labs, and more research. So therefore, I think we are moving in the right direction, and all this data will come in handy.
These are the precautions you need to take in all these things. The way you have presented it, sitting in the hot seat, you have seen the entire country, how you have driven as a part of team, you can say, under the Honorable Prime Minister, able leadership of our Honorable Prime Minister and our Health Minister. Definitely, these things are going to be a library material for future generation to see this kind of webinars wherein you are telling the actual facts, what you have done in this great country to contain a pandemic like COVID. I'm really thankful to you, ma'am. You have come, taken out your precious time. You have come and joined us in our webinar. Again, I would like to mark on record Madam Kavita Narayanan and her support in this getting this webinar successfully done. I invite you to Gandhigram Rural Institute, ma'am.
Sure,
Please
sure,
do come share your views with our students and staff fraternity.
sure.
Thank you
It will
so
be
much.
my pleasure.
Thank
Thank
you so
you.
much, ma'am. Thank you
Bye-bye.
so much. Jai Hind, ma'am.
And